The next speaker, Professor Shu-Ti, and she is a Global Vice President for Capacity Building and International Union for Health Promotion and Education. And he is President and CEO of Health and Sustainable Development Foundation. And she's also the chair for Task Force on Health Promoting Hospitals and Age-Friendly Healthcare, and the former chair of Government Board and the immediate past Director General. And Professor Chiou, today her topic is creating synergies between oral health and the general health. Together, we are stronger. Please.
Thank you, Adam, for your kind introduction. Yes, indeed, together we are stronger. Next slide, please. I will talk about the newly released Taiwan Declaration, and I will show you the relevance of the Declaration for health promotion. And also, I will show you some examples from Taiwan regarding how we create synergies between oral and general health. Next slide, please. This is the Taiwan Declaration on the Integration of Oral and General Health, signed on April 29, 2019 in Taipei. It contains 4 parts. The first is the preamble, followed by 6 facts and 6 priority actions, which we recommend to strengthen the integration, and concluded by 3 near-term activities. And when it was signed here, you can see this picture. Bettina was there, Ellen was there, and Reverend, I think you were there too, and together with our Minister Chen. Next slide, please. I will show you more details about this declaration. So in the preamble, it said that oral health is as important as all other aspects of general health. Nevertheless, oral health is frequently separated from prevention, primary, and specialized medical care. And oral health actually shares risk factors with other non-communicable diseases and presents the same inequality and symptomic issues. The most vulnerable in the population being the least served. And oral health actually coexists with occurrence and consequences of non-communicable diseases and other health issues, as you have heard from Bruce. Next slide, please. So there are 6 important facts. First, oral conditions rank among the top 10 highest healthcare expenditures when compared to other NCDs. And second, oral health is inseparable from general population health. Third, oral health presents shared risk factors. And fourth, oral health itself is also a risk factor for the development and exacerbation of other non-communicable diseases and other problems, such as diabetes, cardiovascular disease, osteoporosis, aspiration pneumonia, etc. And actually, public health as well as oral health promotion, like prevention and control of NCDs, requires a life course approach for all ages. So we target the same population along the life course, and we should do it together. And promotion of oral health and prevention and control of NCDs via public health measures will mutually benefit each other, and integrated actions will lead to best results in improving population health, reducing health gap, and reducing healthcare spending, very importantly. Next slide, please. So there are 6 priority actions we recommended, but there is the B+, the 7th, which I personally also think we should include. So what are the priority actions to strengthen the integration? I will briefly go through, but then I will show you what does it mean, each one through Taiwan's examples. So first, we hope we can apply a health and oral health in all policies approach when we are developing whole of government and whole of society actions, especially when we are doing the health impact assessment in developing these policies. Second, we should integrate oral health screening, prevention, and promotion into the planning and delivery of primary health care to assure equitable and holistic provision of oral health for all. Because for one person, we need whole body health plus oral health for everyone. But we need to have some way of delivering oral health for all to our population. And so we think that primary health care should also consider oral health. However, perhaps when we are delivering oral health, perhaps we can also consider general health. This is the B+. Next. And the third recommendation is to integrate oral health into health promoting activities and health promoting settings, not only in clinical services, but also in settings. And the fourth recommendation is to integrate oral health into holistic health and vice versa in professional education, training, and research. And the fifth is about the collaborative legislative action. And the sixth is about to demonstrate syndemics of the both and the social economic factors throughout the lab course in the public health, education, training, policy development, actions, and evaluations. So we work together in our education, training, and research, but also when we are teaching and training the future policy makers, we should also integrate, show them these syndemics and these synergies. Next slide, please. And following the declaration, 3 near-term activities have been identified also in the declaration. First is to develop advocacy in Asia-Pacific region. Second is to develop thought leadership through global webinars and annual policy meeting. And third is to foster implementation via an action plan tailored to each country's context. Next slide, please. So some examples from Taiwan. Next slide, please. Let's start from policy development and legislative action. For example, when we were planning to raise our sin tax on tobacco, we included the cost of oral cancer and periodontal diseases into the calculation of economic burdens. And then we worked together in the advocacy and lobbying. And after we successfully raised the sin tax, we allocate some of the revenue to invest in oral health. In addition to invest in general health, we invest both. Next. So what did we invest? We prioritize those actions which are evidence-based and can address social determinants of oral health. For example, we provide application of fluoride varnish and gels for free biannually to children under 6. And for example, we provide dental sealants application for molars to all the grade 1 primary school students for free. And for example, our country approved fluoridation of salt together with iodinization of salt. And recently, we would like to ask all the school lunches to use fluoridated salt. And then also we appoint dentists in remote health centers. So in the primary care center, there are physicians and there is also dentists. And all these have the budget coming from the sin tax. So you can see the synergy. We work together and then we invest together. Next slide, please. So how about clinical services? For example, for children, in our well-child examination, we integrate and highlight oral checkup, education, and application of fluoride gel. And in the children's health booklet, we highlighted the dental care together with immunization and newborn screening. You can see how important it is. So each caregiver has this booklet, and each healthcare provider will check this booklet. And when there is any missing visit to dental care, the pediatricians and nurses are encouraged to remind and refer caregivers to visit dental clinics. Next slide, please. For adults, actually 20 years ago, when I developed diabetes practice guideline, we already included a dental exam in our package for the newly diagnosed diabetes patient. And currently, our National Health Insurance has this pay-for-performance scheme for diabetes care. And in this scheme, the package also continues to include oral examination for all the newly diagnosed diabetes patients. Next, we see it as an integral part of quality diabetes care. Next slide, please. And actually, for the most common risk factor in Taiwan, smoking and betel nut chewing, we implement a health promoting hospital model. So every physician, when they are seeing every patient, they should assess the patient's health needs, including the assessment on smoking status and betel nut chewing status. So every physician is also looking at oral health risk factors. And afterwards, if the patient is a smoker or is a chewer of betel nut, then the physician is encouraged to give brief education and to refer this patient for oral cancer screening and for smoking cessation. And for the screening, actually, eligible providers include dentists, otolaryngologists, and some trained physicians. So we work together on oral cancer screening. And for smoking cessation, who are the eligible providers? Not only the trained physicians, but also the trained dentists. So you can see dentists work together, and dentists contribute not only to oral health, but also to general health. Next slide, please. And yeah, so these are just some pictures. Let's move to the final slide. Next, please. Yeah, and next. So we quickly improved in our screen rate. The next slide, please. And we reduced our oral cancer mortality rate. Next slide, please. And we look at the performance on screening of different types of profession. You can see actually dentists perform very well. Next slide, please. Also, and in every kind of settings, for example, the nurseries, the schools, the long-term care institutions, and also the prisons, we include dentists into these settings and the dental health, oral health promotion into these settings. But we hope that in the future, the health promoting workplace can also emphasize oral health promotion. Next slide, please. Okay, so this is the slide showing you that actually WHO for oral health promotion, they also emphasize the risk factor approach, upstream approach. And we should emphasize legislation, fiscal measures, taxation, and organizational change as those examples which I have shown you. Okay, next slide, please. So if we apply the health promotion model, the Ottawa Charter with 5 strategies into health promotion, you can see we can do, for example, we should build healthy public policies, such as legislation to ban marketing of sugary drinks and to impose sin tax on sugary products. And we should create supportive environments, and we should strengthen collective actions, such as brushing your teeth all together in the kindergartens, after lunch, and in the schools. And for example, we should also emphasize enabling personal skills to demonstrate and check correct toothbrushing skills for everyone, especially for the children, since when they are young. And we should reorient health services. For example, we have outreach, fluoride application, and oral health education into the kindergartens and into the schools. So these are the examples we can apply health promotion model in the settings and in policy making all together to build a better future. Next slide, please. And Bruce mentioned the commercial determinants of health. Yes, let's start from commercial determinants of health. If we did not do anything, those commercials, those marketing of sugary drinks will create a lot of problems. This is the vicious cycle. Because of time, I will not go into the details. However, if we do the upstream approach, starting from healthy public policy, if we include the expenditure into impact assessment and we successfully legislate the ban on promotion of sugary products, etc., then we lower the consumption and we save money and we can subsidize healthy foods and health care, and our children will have higher intake of vegetables and fruits. They will have less calories, less obesity, less diabetes, etc., and higher productivity of the society, and reduce health inequality in the future. Next slide, please. So you can see it's the beautiful synergy we can work upon, and we can turn vicious cycle into virtuous cycle. But the key point is we must work together. Thank you.
Yeah, thank you, Professor Chiou. Actually, it is very impressive. I have to show our sincere appreciation to Professor Chiou, because she has done a lot to integrate the oral health to the public health in Taiwan. I think not only in Taiwan, this is a very good model for the integration of oral health with the public health. Thank you, Professor Chiou.